If you're investigating solutions to ulnar impaction syndrome, I suggest you take a look and listen at what happened with my ulnar head wafer resection. I was researching to decide between this and the ulnar shortening osteotomy, and it seems like there were fewer complication risks with this, and it would get me back to my life sooner. I was a higher-end league tennis player prior to stopping play because of this ulnar impaction. Here's a short clip of the last tournament competitive match I played, which was mixed doubles with my wife. I was in a lot of pain, heavily taped under the wristband, and very limited in what I could do. The right side of this picture shows 2 weeks prior to surgery, and the left was 2 weeks post-surgery. I thought they were just going to take a divot out of this area where it was impacting, but they took a lot of bone all the way into my DRJ, which is the distal radial ulnar joint. When I got my bandage off at 2 weeks, the surgeon told me to move it around as I felt comfortable. He told me I couldn't do anything to hurt it or impact the outcome of the surgery. I was supposed to be moving toward normal activities in 6 to 8 weeks, but I still had major swelling and pain at 3 months, and never regained range of motion, particularly supination and pronation. There were serious snapping and cracking noises with very little movement. I saw someone else at 3 months because I wasn't progressing, and he hit me with the crushing news that I was screwed. I had severe arthritis at the distal radial ulnar joint, and the conventional surgeries to resolve this were primarily for pain relief and not restoring function. The only hope for what he called a high-demand patient like me was investigating joint replacement options. He and other doctors I've seen since said the joint space had disappeared in the 2 weeks post-surgery image, and it was likely fusing the two bones even at that point. Obviously, this was infuriating that my surgeon also saw these images and let me go on for months thinking that I was going to get better. This is an MRI 5 months post-surgery. Sequence here shows edema and bone swelling from the arthritis. This next image shows the destruction of the bone. It was noted as, quote, severe erosive arthritis, end quote, in the MRI write-up. Keep in mind, I had done nothing other than range of motion type of exercises, and this is what happened in the 5 months after surgery. So this is what I'm going to have done to try to restore range of motion. It was developed by Dr. Louis Schecker from Louisville, who is retired. I'm going to have the implant performed by his former partner of many years this coming week. They remove the head of the ulna completely, and what you end up with is a constrained ball joint that fairly well mimics the range of motion of a normal wrist. Here is my range of motion currently on my affected wrist. I get slightly more with open hand versus closed fist. And this is followed by a clip of the normal range of motion in my non-dominant hand.